Hello, I, Dr. Sachin Pawar, hair transplant surgeon, HairMD Pune. Friends, we are meeting after a very long time as our clinics were closed due to Covid-19 situation since March 20. Now we have opened our clinics for skin, cosmetic and hair problems. According to government guidelines, we also stopped hair transplant procedure during the lockdown period, as the elective surgery all over world have been deferred in that period. Now, since government has allowed the elective surgical procedures, we have also started our hair transplant surgery. Today, we have done our first hair transplant procedure after lockdown. First of all, we thank all our patients who have waited patiently during this 2 months period for their hair transplant procedure. As we all know, hair transplant is very time-consuming procedure and require patience of surgical team and patient also. And the procedure has to be done very meticulously, and each step has to be performed precisely, whether it is slit making, graft extraction, graft preservation, or graft implantation. Along with this, special care during this corona era, safety of the patient and our staff is paramount importance in hair. So we have decided a special protocol for our hair transplant surgery at HairMD. These are the following precautions we are taking during hair transplant surgery to avoid any transmission of COVID-19 from patient to surgical staff or surgical staff to patient. First of all, the hygiene and aseptic precautions in the OT setting. The operation theatre is thoroughly fumigated with the OT lobby also. There is Hepa filter in the operation theatre. It filters out the air in the operation theatre, which keeps the air clean throughout the procedure. Then, patient selection. Before any patient is selected for the procedure, we inquire about any COVID-19 symptoms, that is history of foreign travel or travel to the contaminated zone in the last 1 month, and history of contact with COVID positive patient. All these his investigations are done and the fitness certificate is obtained. Once the patient reaches to the OT with full stomach, his screening is done by taking his body temperature. Then oxygen saturation is checked. As the saturation drops in the corona positive cases, his blood pressure is also measured. He has to feel the undertaking that he has not have any COVID-19 symptoms and he has no travel or contacts. The patient changes into the sterile OT dress. Patient has to wear surgical mask throughout the procedure. Patient's temperature, oxygen saturation and blood pressure is recorded during the procedure also. He has to do the Betadine gargle every 2 hours to keep his mouth and throat clean. The staff protocol. We, the surgeon and whole surgical staff, is screened for COVID-19 symptoms. Only then they are allowed to work in operation theatre. The whole surgical team is in full PPE gear throughout the procedure, which include surgical gown, N95 mask with triple layer surgical mask, face shield and double gloves. With all these precautions, we make sure that our patients get the best possible care during entire procedure. With these precautions, it is paramount important to perform all the steps of the surgery meticulously as we are doing them over many years to give our patients the best possible result from the hair transplant. So friends, the take-home message is, if all the guidelines for doing any kind of surgery are followed and all precautions are taken along with the high standard of surgical technique and instrumentation, then in this era of corona, hair transplant surgery can also be done with safety. And we at HairMD are committed to do our best and ensure the highest standards for our patient and staff. Thank you.